Joining me now is Dr. Jay Bott. He is a primary care physician who previously served as Senior Vice President and Chief Medical Officer of the American Hospital Association. Doctor, appreciate your time tonight. I want to start right there with that booster shot from Pfizer. They're seeking approval for that third vaccine to combat the virus. How important is this?
Thanks for having me. I think it's critically important to do everything we can to prevent moderate, severe disease, hospitalizations, and death. And so if the data shows us that with another booster we can do that, we can increase antibody protection, then that's great. I would say that we haven't studied the time period it takes for antibody levels to wane enough. I'd like to see more data before we make decisions about recommending a booster. We still have many more people to get 2 shots into first. I mean, less than half of all states, 20, have met the 70% threshold set by President Biden. And I'm very concerned about this Delta variant. The COVID virus we know doesn't discriminate, and we'll find whoever it can infect. So given unvaccinated pockets, people returning back to the new normal, not using masks as much, and this variant, there's enough ingredients to drive another surge in an area with growing cases.
And before I talk to you about the Delta variant, which obviously is a major concern, in terms of a booster, how would it work? And I think the question for a lot of folks is, if I had the Moderna vaccine or the J&J vaccine, is there a booster in the works for me, or would I also be able to get the Pfizer?
I think there's more ongoing study around that question. I think we have some data that suggests that you may be able to, but it's not clear. I think we do know that if you're able to get more vaccine of the same vaccine you got, then you're better off. Now, the important thing to recognize is that an mRNA platform that Moderna and Pfizer uses is used because of the flexibility of the technology in comparison to traditional vaccine technologies. And boosting is one of these advantages. They allow for the time when a strain that escapes protection from the vaccine, if that were to emerge, the updated vaccine could be administered as a booster. So we haven't encountered that yet. I think the important thing to recognize is nearly 95% of severe illness, hospitalizations, and death is prevented with the Moderna and Pfizer vaccination, and that's the most important number.
And in terms of the Delta variant, now the most dominant in the country, states like Missouri, Kansas, Mississippi seeing the spikes, as Adrian just mentioned. What concerns you the most about the Delta variant in terms of hospitalizations, risk factors, and the severity of the illness?
I think it's very concerning. I think we're seeing outbreaks. We're seeing hospitalizations rise in Utah, Missouri. I mean, Utah has seen the third highest increase in the last month throughout the pandemic. We're seeing people in the ICU that are unvaccinated, and we're seeing that younger people are unvaccinated. And so it's important to get as many of those people vaccinated as possible. The other thing is, there's a study that recently was released this week from Yale and the Commonwealth Fund showing that the quick rollout of the COVID-19 vaccine in the U.S. saved an estimated 279,000 lives and prevented 1.25 million hospitalizations. It just doubles down on the fact that getting vaccinated saves lives. And it saves not only your life, but your loved ones and the community around you. The thing I would urge people to do is mask indoors and get vaccinated. I think that that's going to be your best bet. And continue to stay away from large gatherings in which where there are high number of cases in that community.
Well, certainly a concern if we're seeing these spikes now in the summer months, Dr. Bott, and as we head into the fall, people head back inside, what this Delta variant will do then. Great information tonight, Dr. Jay Bott. Appreciate your time.
Thank you for having me.